This is Dr. Jack Allergy. You can follow me on my YouTube channel, Dr. Jack Allergy. That's DrJackAllergy. You can follow me on Twitter at hashtag Dr. Jack Allergy and on live.me, the app at Dr. Jack Allergy, all spelled the same way. Okay, what I want to talk about is the correct technique for the use of epinephrine auto-injectors. So if somebody is experiencing anaphylaxis, what do? Well, you give your epinephrine and you call 911, or you have somebody drive you to the ER. Why? Well, epinephrine, 1 out of 6 people will require a second dose, and it only lasts for 30 minutes. So it wears off. So you want to be in a safe place. That's where an ER or a 911 is important to have, because sometimes, very rarely, epinephrine by itself is not enough, and you might need additional therapy, and that's what an ER can provide. Okay, so epinephrine auto-injectors. This is a hot topic. It's disgusting that the companies sell it for so much, and why do I hate them? For the very fact that this is not a daily medication. This is something that's a life-saving medication. Look at all the studies. There has never been a study that proves that anything other than epinephrine saves a life during anaphylaxis. Okay, so this is something I hope my patients never have to use, but when they do, it should be free. Just like the nitro tablets that people take for their heart attacks and chest pain. The same thing should be with epinephrine. It costs pennies, and the device isn't that expensive, and that's why these companies are disgusting. Write to your congressman, write to the companies, write to anybody who will listen. It's disgraceful. We need to get that changed. Okay, that's enough said. How do we use them? Well, I have samples or examples of some of the epinephrine auto-injectors on the market. There is a third one called Adrenaclick. It is a generic one. I don't have an example of that, but you can find it online, Adrenaclick. Just Google it, and it has a lot of videos on how to use it. This is Epipen, the one that's ridiculously, disgustingly expensive, but I have examples of this. This is the green one. It's the pediatric dose, 0.15 milligrams. It has a little window that shows you if it's clear that the medicine is still good. Don't leave these in your car or your glove box. They do your car no good. A car doesn't have anaphylaxis, and when it gets really hot and really cold, and you wish you had your medicine, it might not be effective because the temperature changes. Okay. How do you use this? Okay. Open up the top. These come in 2 packs, which usually they typically will come like this, 2 of them in 1 container, and a trainer. So these are the real ones, and a trainer that you can and should practice with. Okay. That's the adult dose. Yellow is the fuller, the adult big time dose. This is the smaller children's dose. Although I tend to err on a little bit more is better when it comes to epinephrine and anaphylaxis. Okay. You would open this, take this out. There are instructions. This is simple to use. This is where the needle is. It says needle end. This is the top. Do not hold it like this, or you will end up with a needle in your thumb. Not going to feel nice. This is the correct way, and there are instructions. It says, remove the blue safety release by pulling straight up without bending or twisting. Take it off. Then, all you're going to do is swing and firmly push the orange tip against your outer thigh so it clicks. You're going to smack your outer thigh through the clothing. That doesn't matter. Lateral thigh in the fat, fleshy part, not straight up and down. Straight up and down, there's a chance you could hit the bone. And trust me, that's going to hurt even more. So, lateral thigh, hold it there for 10 seconds. The medication will be delivered within 1 second. 10 seconds is to ensure that all the medication is delivered. Okay? I'm putting this back in just so it doesn't accidentally happen. And then you remove. The next thing you do is you call 911, or you get somebody to take you to the ER. You keep your second dose with you. Okay? that is the way that you use the epinephrine auto-injector known as Epipen, okay? The adult dose is the exact same thing. Adrenaclick is very similar, okay? There is another product on the market known as auvi-q. This is the smaller pediatric dose. There is an adult dose, which is a red auvi-q. Auvi-q currently is not available to the public. It has been, but there was a production problem, and so right now it's still being held up. Okay, this is my favorite. Not because of the medicine, because they're all the same medicine, but because of the device. Look at this. The size of this. This is smaller than your cell phone. You don't have this big, clunky, ridiculous thing that doesn't fit in any pocket and sticks out everywhere. You don't need to announce to the world unless you're having anaphylaxis. What's nice is, look, fits right in my pocket. Nobody has to know. I don't have to know. It's just there. It doesn't get in the way. How do you use it? It's simple and easy. Now, listen.
To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds.
Now, just want to keep her a little more quiet because she'll keep talking. So what you're going to do is, and the trainer actually does the same thing without any medicine, but what you do is you pull off, you drop this, and you pull this off.
To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds.
That is essential.
If not ready to use, replace the outer case.
See, she will talk to you and she will actually count down what needs to be done when you're actually doing it. I'm sorry. I just wanted to put this back. Okay, so now that way it doesn't shoot. But you just put this against your skin and then you press down. You hold it there and she will actually count down. 5, 4, 3, 2, 1. Injection complete. Then all you do is you replace it right back in here. Okay? Who cares? I don't care where you replace it. I want you to just make sure you get the medicine inside your system. This is a great little device. There are coupons for it. Once it becomes available on the market again, utilize this one if you can, but I say go with the cheapest. Who cares? Something else to know. The instructions are written on this. It tells you exactly how to do it. Okay? Call 911. Now, medications are ridiculously expensive, especially for something that we are hoping you never have to use. These companies offer free samples to your school, not to work, but to your school. So you can ask your school if they want to have your epinephrine auto-injector there, at least one of them. You could say, I can't afford that. And you can actually have them contact the company. There's on any of their websites, there's a form that the school nurse and or staff have to fill out and maybe get a doctor to sign, and any doctor would sign it gladly. And they can get 5 free samples, or at least 5 2-packs, I believe, because these come as 2 of them together, because 1 in 6 people will need a second dose. And so they can have those samples sent to them so that you don't have to give them one of yours. Okay? Epinephrine is the only thing that's ever been shown to save somebody's life during an anaphylactic event. Not Benadryl, not antihistamines, not steroids, nothing. Epinephrine. If in doubt, use it. Then call 911. This is Dr. Jack Allergy. Please feel free to comment below, and if you have questions, feel free to write them below. I will try to answer them. I don't check every day. I'm sorry, I don't have that luxury. If you like this, please give me a thumbs up. You can follow me on this YouTube channel. You can also follow me on Twitter at #DrJackAllergy and on the live.me app at Dr. Jack Allergy as well. Hope you have a wonderful day, and I will continue to make as many videos as I can educating you how to be better patients and better knowledge for your own health. Have a wonderful day.